Here at Atlantis, we take a different approach at weight loss, managing these hCG patients. The idea here is to reset the metabolism, improve the metabolism, and not just for the duration of the protocol, but long term.
Before I came here to Atlantis Medical, I worked out every day or every other day. I ran, I'm actually a co-athlete, and I just really couldn't get over that hurdle. I would eat, great Monday through Friday, and then on Saturday and Sunday I would sabotage. And I realized that I needed something that can actually, help me, just think a little bit clearly. Weight loss happened. That's what happened. What actually happened was that, I changed. My relationship with food actually changed. My discipline actually got heightened.
We want patients to understand that hCG is not a diet. So when they come here, we look at things like their hormones, we look at things that have contributed to their weight gain, and we look at their overall health. We don't just want to do an hCG protocol and a diet. We want to look at all the other things that have caused them to get into the state that they are when they came here with us. What we find with these patients as they come in week after week to weigh in, and we're teaching them how to eat and we're teaching them how to exercise, it's just their overall improvement of their health.
I know how to measure my food. I know how to measure how much protein I'm supposed to have, how much carbs I'm supposed to have, how much sugar intake I'm supposed to have, and how much exercise I'm going to have to reduce the calories. It's a new me. I feel as if, I changed 3 pant sizes, had to donate half of my clothes, and it feels great. I love myself a little bit more. I grew a beard. I'm wearing XL t-shirts. My wife is kind of saying, wow, look at you, My coworkers are kind of like, hey, what happened, and I actually know what happened. I actually took my health a little bit more serious, and the protocol helped me do that.
The great thing about Atlantis weight loss is that patients sometimes come here just for aesthetic improvement on their weight, and then they find out that they were a borderline diabetic or that they were having heart issues, and we're able to not just get them in a better place aesthetically, but to get them in a better place health-wise. And so we take so much time with our patients. We get to know our patients, and we're rooting for our patients the whole time that they're on this journey. But we also encourage our patients to come in and weigh with us and check in, and we call them and check in on them, see how they're doing, because we don't just think of this as just a short-term losing weight. We want them to maintain their weight loss and just improve their overall health.